Good afternoon, everyone. I'm so glad you're here. Today we're diving into a topic that a lot of people are curious about, but rarely talk about openly. What really happens if you ejaculate every day? Now, before you tense up or start wondering if this is going to be awkward, take a breath. This isn't about shame, it isn't about judgment, and it certainly isn't about telling you what you should or shouldn't do. This is about knowledge. It's about understanding your body. It's about replacing myths with facts and anxiety with confidence. Because when we understand how our bodies work, we make better choices, we feel more in control, and ultimately we show up in our lives with more energy, more clarity, and more self-respect. So today, let's talk honestly, let's talk scientifically, and let's talk in a way that empowers you, not scares you. Let's answer the question people whisper about with the clarity they've been waiting for. What really happens when you ejaculate every day? Daily ejaculation is generally safe and normal, and understanding this can help remove unnecessary worry or stigma around a very common human behavior. The body is designed with natural regulatory systems that adapt to individual patterns, and sexual release, whether through partnered activity or masturbation, is simply one way those systems function. People often assume that higher frequency must place some kind of strain on the body, but in reality, the body replenishes what it needs continuously, and sexual activity does not deplete essential resources in a harmful way. What varies the most from person to person is comfort level, energy, and emotional context, not physical safety. For many individuals, daily ejaculation can be part of stress relief, mood regulation, or simply a healthy expression of sexuality. For others, a different rhythm feels more natural. Both are completely valid. The key point is that frequency itself is not an indicator of health or dysfunction. Different bodies respond differently, and personal preference plays a larger role than any rigid rule. When people hear this, it often reduces anxiety and helps them view their own habits without judgment, because they realize there is a wide range of normal. Frequency does not harm long-term sexual or reproductive health, and this is one of the most important facts people often overlook when thinking about daily ejaculation. The body's reproductive system is built to handle regular sexual activity, and sperm production operates on a continuous cycle that naturally replenishes itself. Ejaculating more often doesn't use up anything vital. It simply reflects the rhythm of the individual. Many concerns come from outdated beliefs that frequent ejaculation weakens the body, lowers testosterone, or reduces fertility, yet evidence consistently shows that hormonal levels remain stable and the testes maintain normal function regardless of how often someone ejaculates. What matters far more is overall lifestyle, such as sleep, stress levels, and physical health, rather than the number of times a person orgasms. Some people notice slight variations in sensation or volume depending on timing, but these are normal physiological fluctuations rather than signs of damage. Understanding this helps remove the pressure to meet certain expectations or to avoid natural urges out of fear. It reinforces the idea that sexual frequency is a personal preference, not a medical issue, and that long-term health is not threatened by choosing a pattern that feels natural and comfortable. Understanding your own body's patterns builds confidence and reduces anxiety, because it allows you to make choices based on awareness rather than assumptions or myths. When people pay attention to how their body responds to daily ejaculation, or any frequency, they start to recognize what feels normal, what feels good, and what feels balanced for them. This kind of self-awareness removes the sense that sexuality is something mysterious or out of control. It gives individuals a clearer sense of their physical rhythms, energy levels, and emotional responses, which in turn makes their decisions feel intentional rather than reactive. Many worries around sexual habits come from comparing oneself to others, or from cultural messages that imply there's a right amount of sexual activity. But when someone understands their own natural pattern, they stop evaluating themselves against unrealistic standards. Instead, they begin to trust their body's signals and feel more grounded in their own experience. This shift in perspective creates a calmer and more confident relationship with sexuality because the focus moves from judgment to observation. It encourages people to treat their sexual health the same way they treat any other aspect of well-being, with curiosity, self-respect, and a willingness to listen to what their body is telling them. So as we wrap this up, remember that your body isn't something to fear or doubt. It's something to understand. Knowledge replaces anxiety, and clarity replaces shame. When you trust the science, trust your instincts, and trust your own rhythm, you give yourself permission to live with confidence instead of confusion. Your sexual health is just one part of your overall well-being, and the more you approach it with honesty and curiosity, the stronger and more empowered you become.